What if I told you that there was a world where people could not get the health care that they needed and the health care that they deserved simply because they didn't make enough money? Unfortunately, this is a reality today, and it's a world that we live in. Thousands of Idahoans every single year go without the simple, necessary treatment that they deserve because they don't make enough money. So today, I'm going to talk about why we should expand Medicaid under the Affordable Care Act here in the state of Idaho. According to the 2024 Idaho Capital Sun, additional federal funds for Medicaid would grant $1.5 billion in economic output in one single fiscal year here in the state of Idaho. A lot of research is being done on this now. This is a very relevant thing happening. I work in a pharmacy and in a hospital, and on a daily basis, I see people turned away that can't afford certain medications, and they also don't qualify for Medicaid based on the current requirements needed to get that awarded to them. There are three things that passing Medicaid in Idaho, or expanding Medicaid, in the state of Idaho would do, and I'm going to explain those three things today. The first is that it would provide health care access to thousands of uninsured residents. In the state of Idaho, like I stated before, there's over 80,000 people who are uninsured each year just in the state of Idaho. That's a lot of people. With that number of people, that's probably somebody that you know. That could be a friend, a family member. 80,000 people that don't get the treatment that they need because they do not qualify for Medicaid as it currently stands. Second, it's going to improve overall health and safety for everyone in the state of Idaho. And third, it's going to reduce the financial burden not only on the hospitals and services like pharmacies and doctors' offices, but it's also going to help the taxpayer in the long run. And I'm going to explain all of that to you. So first, the Kaiser Family Foundation has stated that there are over 80,000 uninsured people here in the state of Idaho. As an Idahoan, I truly believe that everybody deserves health care that not only is affordable, but that can be sustainable and help us live long, healthy, happy lives. We can do this by pushing Medicaid so that it's more affordable, but that it's also more equal, and so more people can get on board with it. One thing with Medicaid now that is a severe problem is that people will make too much money to qualify for Medicaid while still not making enough to qualify for anything else. So they'll make more money that disqualifies them from getting the health care that they need, but they still qualify for food stamps and government housing. That doesn't make sense. That's wrong. We need to fix this, and we can do that if we expand Medicaid under the Affordable Care Act that is now intact here in the state of Idaho. Another problem is that lack of coverage for these people leaves them with nowhere to go, which in turn, through studying the statistics, leads to higher drug usage, alcohol usage, suicide rates, because people feel helpless. They don't get the help that they need. So, the solution to this, if we look at the Centers for Disease and Control Prevention, like the states of Utah and Montana, they have started to expand Medicaid, and they have seen great results from this, the opposite of what is currently happening here in the state of Idaho. The Idaho Department of Welfare states that Medicaid expansion would lower uninsured numbers by over 40%. We could see these numbers come down in just one fiscal year of over 40%. 40% of 80,000. That's a lot of people that would benefit just from expanding this and opening it up a little bit more for each individual person. So now let's look at it from the second standpoint of improved public health and safety outcomes from this. when people get the help that they need, chronic conditions such as diabetes, hypertension, mental health issues, etc., are going to come down. The overall health and well-being of people is going to go up. They're going to receive more care than they are now. And when people are healthier, generally speaking, they're happier and they're contributing more to society. And so it's going to be one big loop that we get just from improving the overall health of people here in the state of Idaho. Now, I want to discuss the third topic, and that is the financial impact that this would have. Emergency services currently are burdened by those who cannot pay their bill. It goes to collections, it's never paid. This debt affects the taxpayer. It actually raises our taxes. The American Hospital Association states that Medicaid expansion resulted in a 25% reduction in care costs for hospitals. This is in states that have expanded Medicaid in the way that Idaho should. The first argument against this is, well, wait a second. My taxes are going to go up. Yes, we would have to pay higher taxes, but the overall effects of people is going to outweigh these taxes. The federal government actually covers 90% of Medicaid cost. So the taxes going up on Idaho residents really won't be that much. It will be higher, but I believe that it would be worth it in the end. According to the Idaho Department of Welfare, Medicaid has led to a 50% decrease in catastrophic care, and it is also resulting in significant savings. Another thing to build off of that is that when people are in severe pain and in catastrophic care, they're out working, they're out contributing to society, which is actually going to help in the long run. The second counter argument is that Medicaid is going to encourage government dependency and not independent workers. This has actually been debunked. Research does show that Medicaid expansion encourages low-income individuals to maintain employment. As I've stated before, when people are healthy and happy and they feel good, they want to work, they want to contribute. It's one big cycle. I'm happy, I'm healthy, I have the health care that I need, I'm contributing to society. It's a great one-circle way. A 2019 study by the Urban Institute found that Medicaid expansion helped low-income individuals maintain or seek employment, ultimately leading to greater self-sufficiency. So, in conclusion, why Medicaid should be expanded under the Affordable Care Act? 1. It provides the health care access that so many Idahoans do not receive each and every year. 2. It improves public health, which improves public safety and overall well-being of everyone here in the state of Idaho. And 3rd, it will actually reduce the financial burden of hospitals, doctors, taxpayers in the long run. It's all positive.